Our next speaker is Dr. Thelma Mielenz. She's an assistant professor of epidemiology at the Mielenz School of Public Health at Columbia University, and her talk is titled Assessment of the Physical Health Domain in LongROAD, Self-Report and Performance-Based. Dr. Mielenz.
Okay, good afternoon. So happy to be here today, and as I said, I'm going to talk about the physical health domain in LongROAD. And I'm going to jump sort of right into the domain of physical health. There is work looking at physical health and some of the measures that I'll be going over today and driving outcomes. We've published some recent reviews on physical function and driving outcomes, and we have some work coming out with using the NHATS data looking at some of the driving outcomes. So I'm going to go ahead at this point for this talk, sort of just jump right into the measures that we'll be using today. And so we're talking about measuring, functional status. So, why is this important? Probably the key item I'll point out on the slide here is just, it's really an indicator of the level of independence. So many of you probably think of measuring, activities of daily living. This is commonly what you'll think of, maybe to keeping someone independent. Maybe you're going to expand into the instrumental activities of daily living. And these, measures are great and they're key. But the issue is that, when you're thinking about community dwelling older adults, that really they just don't have enough sensitivity to discriminate across a wide spectrum of functional disability. So we need to measure more. Doesn't mean we'll measure these, but when you're looking at a greater than 65 in community dwelling, only 10 or 15% will have that ADL limitations. So this is why we're measuring both a mix in a lot of our health domains here, social and mental. We're doing a mix of the self-report and performance-based, or what I have listed here under clinician-reported or trained staff reported, which, the self-report, I think all of you can think of the survey, and then the trained staff reported are, you saw some of the measures that Dr. Ryan went over as well, and we have equal ones in our physical health domain that I'll go over. So just to jump into the ones we're covering in LongROAD for our self-report measures, if you look at the first four there under the physical health domain, looking at assessing physical function, fatigue, pain interference, or sleep disturbance, we're using all of the PROMIS measures, and I'll just briefly go over what those are for those of you that are unfamiliar. And then if you go on down and look at physical health and falls, we're using measures, questions that were taken from the NHATS study, and I'll just very briefly go over that. And then the last three are a mix, a self-report, and also we'll be doing some of the performance-based to cover the frailty phenotype. So those are the main ones that I will cover for our self-report measures in physical health. So very briefly here, we are utilizing the measures that are self-report measures from PROMIS, which for those of you that are familiar with this is an NIH roadmap initiative that's gone on for over 10 years, and they we kind of followed their domain of the physical, mental, and social health, and they adapted this from the WHO framework. So again, what I'm talking about this afternoon is the physical health domain. And what I wanted to do is just give you one example of, so we're saying we're using the PROMIS physical function measure. What does that mean, really? So what PROMIS did is they created a physical function function item bank. And the first thing to do that is they had to define, what is the latent construct they're measuring. So you can see here in quotes that they're defining physical function as the ability to carry out various activities that require physical capability, ranging from self-care to more vigorous activities that require increasing degrees of mobility, strength, or endurance. And so in order to create this item bank, because a lot of people will say, well, wait a minute, the promised measures aren't, they're not validated yet. Well, they're made up of these very measures that people have considered reliable and valid in older adult populations for a long time. So what they did is take a lot of these items from these the HAQ, the Health Assessment Questionnaire. It's commonly used in arthritis, as is the WOMAC. All of you are probably familiar with the PF short form 36, or which has the PF 10 in it, the physical performance 10. So anyway, all of these items were sort of dumped into a big bin, and they took them out for repetition, and they passed them by a wide variety of subjects to make sure that they were at a the questions were understood, and they were at a readable, I think, 6th grade reading ability. And then they went out and tested them using item response theory. They used the they used a graded response model and to using modern measurement theory to test them. And so again, the reason I'm showing you this, and this is when people after lunch are about going to fall asleep, so I'll be brief with this slide. So anyway, I think the key thing is, if you think about this, these are standard errors, but if you think about, you can flip them and think of them as like an information curve, similar to you would like a normal distribution with standard deviations, and what you can see with this slide is that the promise measure just can cover a wide degree of physical function. If you see physical function as the theta on the bottom, that the measures just do a really great job. So from all the way out to -4 standard deviations to close to 1, the promise measures can kind of measure a wider spectrum. So that's why they're good ones to use. So I'm just going to move off the physical function ones and let you know the other measures that we are measuring for physical function, including fatigue. We're doing pain, both interference and intensity. I've already mentioned the physical function and sleep disturbance. And the other thing that we're doing is we're measuring the PROMIS 29, which is it's a adult profile. So it really covers, it's sort of a, it covers, you can see both mental and social and physical all in one. I'm focusing here on the physical ones, but it will enable us to cover a lot of these domains very efficiently. So the next measures I mentioned were from NHATS. So I'm sure a lot of you are familiar with this study. It's the National Health and Aging Trend Study. The PI is Dr. Casper out of Hopkins. And we're using questions, as I mentioned, from that study on falls and balance, and I think assisted devices. I'll just jump to our next domain here, which is frailty, and wanted to just mention Dr. Matt Baldwin for this is his slide here, so we're measuring frailty and sort of put this under the physical health domain, and you can see here that. Frailty often occurs with a disability and a comorbid disease, but you can see from the Venn diagram, it's not exactly either of those. So if we think of it as this age-related increase in vulnerability for developing adverse outcomes when exposed to a stressor, and this is Dean Fried's representation of frailty as this systemic loss of physiological reserve. We'll come back to this slide in a minute with our measures put on top of it. So Dean Fried, who is at the Mielenz, has been one of the leaders in the field with her work in frailty here. This is a larger team, and many others have worked in this area as well. And they came together and sort of came to a consensus on frailty, and they came out with these four major points, which, frailty is an important medical syndrome, and that, it's very important to screen for it. So you can see here that these are what we'll be collecting in LongROAD: weight loss, exhaustion, low activity, slowness, weakness, and we're doing slowness with gait speed and grip strength, so we're starting to go over to the physical performance measures here. Here are the measures put on top of our diagram for the Freed's Frailty Index here. So, this can kind of gives you a framework for why we're collecting those particular items. And then this, just to follow up with the last two consensus points, so it's a manageable condition, so I'll just say evidence for treatments, exercise, I'll move on. And then, let's see. I think my fourth point, I'm just going to jump on here for the sake of time. And so again, you saw with the grip strength and gait speed, we're starting to go into more performance-based measures of physical functioning. So what is performance measure of physical functioning? It's an assessment of, so it's an assessment of an instrument in which an individual is asked to perform a specific task and is evaluated in an objective, standardized manner using predetermined criteria, which may include counting of repetitions or timing. So these are the performance-based measures that we're collecting, and you can see we're doing the short physical performance battery, grip strength, a 9-hole peg for dexterity, rapid pace walk for walking speed, and the Maritoli method for range of motion of the neck. We have listed here some of the reliability and validity and research, and then where these items came from. So the short physical performance battery, there are three standing balance measures that are performed, which is just a side-by-side stand, a semi-tandem stand, a tandem stand, a 4-meter walk, and chair rises. Here is a quick example of the chair rise. Let me see. Okay, so this is, we don't have time. It just gave you an example of, it's an embedded video of someone doing a chair rise. I think you can get a sense with this. And this has been used in many large cohort studies in aging. And it is available if you go into the NIH website. Dr. Goralnik, who is also consulted on this project, is the one who developed it at NIA. The last two, and then I'm going to finish up, is we are using the 9-hole peg dexterity test, which I think many of you in driving are familiar with. It's also being used in what they're calling an NIH toolbox, which is an initiative that they've developed to do performance-based measures. And then our other one that is in here is the grip strength, which is also part of the NIH toolbox. So that's it. Thanks.